I am Dr. H.K Chopra, Senior Cardiologist, Moolchand Medcity, New Delhi, India. The topic given to me today is to talk on heart failure. Ladies and gentlemen, heart failure is a very common problem, especially in the post-COVID era. Heart failure is preventable, regressible, and reversible. First of all, my aim is to talk as to what is heart failure. Heart failure does not mean you should be worried that something is failing in you, but something is not adequately acting, not adequately functioning, is what we call as dysfunction or a little failure. The heart failure means when the heart does not pump the blood as it should. Normally a heart pumps 60 to 70 times per minute. The contraction of the heart pumps the blood, and it is this blood which goes to the brain, kidneys, eyes, in the whole extremities and everywhere. When the heart fails to pump, this is called as heart pump failure. Now there are two methods which we must understand. Heart failure is not cardiac arrest, and heart failure is not a heart attack. Heart failure can happen when the heart fails to contract adequately. We call it a heart failure with reduced ejection fraction. Another condition where the heart fails to relax, when the heart does not relax adequately or the heart muscle is stiff, we call as a heart failure with a preserved ejection fraction. This is very important. We all should know the prevalence of heart failure is rising steeply in our country, especially in the post-COVID era. What are the common causes of heart failure with preserved ejection fraction? Number one cause, uncontrolled hypertension. Number two cause, uncontrolled hypertension. Number three cause is uncontrolled hypertension. So you can understand the severity. Number two, it can be diabetes, obesity, dyslipidemia, or a patient has got sometimes kidney problem or pulmonary arterial hypertension or a lung problem, or there are multiple issues. If a patient consumes oral contraceptive pills or in postmenopausal they have a hormonal replacement therapy, all they are the contributory factors but so-called heart failure with preserved ejection fraction. And what is a heart failure with reduced ejection fraction? This is usually occurs post-COVID. We have seen a lot of patients where the heart is enlarged and heart does not pump adequately. What is known as cardiomyopathy, COVID cardiomyopathy. Second is known as coronary artery disease or a heart attack induced when the blood supply is less to the heart muscle, is also known as ischemic cardiomyopathy. Similarly, there are many cardiomyopathies or when the heart enlarges and does not pump adequately, the pumping action or the ejection fraction is low. What are the symptoms? The common symptoms are shortness of breath. They get palpitation. They get sweating on walking. They may have edema or swelling in the legs, puffiness of face. These are the common manifestations. Sometimes even they may get dizzy spells. How do we diagnose? Ladies and gentlemen, it's a great matter of concern. Every one of you should know how do we diagnose heart failure. And the simple way to remember, clinico, echo, NT-proBNP navigation. I repeat, clinico means clinical, echo means echo is a must, and number three is NT-proBNP. NT-proBNP is a test which gives you the severity of the heart failure. Every one of you should know. If you go to United States, Japan, or Australia, or UK, everybody knows what is NT-proBNP and they should go for an echo test. Echo and NT-proBNP are the cornerstones in the management of heart failure. I won't put the details of this, but you should know how can we prevent heart failure. I tell you all the precautions. no smoking please, no obesity at any cost. You are not to be obese. No excessive consumption of alcohol. And number 4, very important, please make sure your cholesterol fit. You don't have a high cholesterol. And number 6, you must sleep adequately in the night. Sleep is a must. There is a very strong relationship. Sometimes when a person sleeps, he is obese, he gets what we call as obstructive sleep apnea. इसे हिंदी में कहते हैं खर्राटे भरना. जो इंसान खर्राटे भरता है उसको ज़्यादा हाई ब्लड प्रेशर होता है और उसको हार्ट फेलियर विद प्रिजर्व्ड इजेक्शन फ्रैक्शन होता है. इसके बारे में हमें जानकारी होना चाहिए, बहुत ज़रूरी है ये. एंड देन वेरी इंपॉर्टेंट, वी शुड टेक ऑल द प्रिकॉशंस टू हैव रेगुलर एक्सरसाइज and no sedentary lifestyle. What is the treatment? I won't go to the details, but you should know your doctor decides a protocolized treatment. The treatment for heart failure is only in the heart failure clinic, who have an echo, who have ECG, who have anti-proBNP facility, and they know how to optimize the treatment. The whole world. In fact, you'll be surprised and very happy to know that we wrote 2 textbooks from Moolchand Hospital in cardiology or heart failure. So where are we going now? So much of work has been done, and we must launch again Mission Heart Failure Care in India. That's the only way we can reduce the rising menace, the rising morbidity and mortality which is heart failure infected. Thank you very much for giving me this opportunity on the platform of Moolchand Hospital, New Delhi, India. Thank you.